Hello and welcome. You are stood outside 34 Berkeley Square. Today we're exploring the life of a pioneering figure in British medical history, Dr Eliza Walker Dunbar. She's one of the first women in the UK to qualify as a doctor, and her work reshaped the landscape for women in medicine during a time when that profession was overwhelmingly male.
She lived through a pivotal era, born in 1845 and working well into the early 20th century. Her story unfolds against the backdrop of both Victorian conservatism and early 20th century reform. It's a window into medicine, gender and power.
And it's not just about her qualifications or appointments. It's about how she pushed through resistance, founded institutions and quietly changed lives and systems. So today we're going to walk through her life and legacy and reflect on the world she had to navigate to make it all happen.
Let's start at the beginning. Rob, can you tell us about Eliza's background?
Sure. Eliza was born in 1845 in Bombay, what we now call Mumbai, to a Scottish army surgeon. Her family, like many in the British colonial system, eventually sent her back to England for her education.
And that's when she went to Cheltenham Ladies' College, which was fairly progressive for its time, right?
Exactly. Cheltenham was under the leadership of Dorothea Beale, who championed academic education for girls. Eliza would have received a strong grounding in science, unusual for girls at the time.
So already she's in environments that were preparing her to challenge convention, but when she starts pursuing medicine, there are immediate challenges.
Yes, absolutely. After some early training in Frankfurt and at the Elizabeth Garrett Anderson's dispensary in London, she was essentially blocked by the Society of Apothecaries, who actually changed their rules in 1867 to exclude those who had not attended regular medical schools.
So that effectively bars all women from attending medical school?
Yes, that's exactly what it does.
So what options did a woman like Eliza have at this point?
Well, essentially, she had to leave the country to study. Luckily, in the same year, the University of Zurich opened its doors to female students. This made it one of the only institutions in Europe that admitted women to its medical programme. Eliza was one of the youngest group of women known as the Zurich Seven, who gained a medical degree from Zurich. She graduated in 1872, receiving an MD with distinction. Zurich became this interesting centre for women's medical education.
And she didn't stop there. She became the first woman assistant in Zurich Canton's Hospital Women's Ward. She went on to do a postgraduate study in Vienna before returning to England.
So she arrives back in Britain in 1873 and lands this historic appointment, house surgeon at the Bristol Royal Hospital for Sick Children, the first woman to ever hold a hospital post in the UK.
And I think we all agree this does sound like a breakthrough.
It really was. She got the job on merit, beating out 12 other male candidates. When the hospital staff were informed of her appointment, they threatened to resign, but the Board of Governors backed her, and the press coverage suggested there was much public support, locally and nationally.
However, despite, from our perspective, this surprising level of support, there were still challenges. When a dispute arose over patient care between Dr Dunbar and another member of staff, the remaining doctors, all male, walked out. Part of the problem was that Dr Dunbar was the only salaried doctor at the hospital. The male doctors were all honorary staff volunteering their services. Recognising this impasse, Dr Dunbar resigned shortly afterwards.
What stands out to me is how calm and composed she was in her response. She didn't dramatise it, she just moved forward, and that really defines her approach throughout her career.
After leaving the hospital, Eliza set up a private practice in Clifton, Bristol. In 1874, she began using the name Eliza Walker Dunbar, incorporating her father's surname as part of her professional identity.
And just a couple of years later, in 1876, she established the Reed Dispensary for Women and Children, offering accessible care for working class women. That was a major public health contribution.
Right around the same time, there's a big change in medical legislation, the Medical Act of 1876. Rob, can you explain what that meant to her?
It meant that, for the first time, examining boards in the UK were allowed to licence women. Eliza qualified through the King's and Queen's College of Physicians in Ireland, which was among the first to actually license women. She was officially added to the UK Medical Register in 1877.
And that registration wasn't just paperwork. It gave her formal authority, institutional legitimacy, and opened doors for other women to follow.
So at this point, she's running a practice, leading a dispensary, and in 1895 she goes even further and establishes the Bristol Private Hospital for Women and Children.
That's absolutely right. What made it revolutionary was that it was entirely staffed by women. That meant women could not only receive care in a more supportive environment, but women doctors could also gain experience in leadership roles that they couldn't get elsewhere. And that really mattered. Even after women could legally qualify, many hospitals still refused to hire them. Dunbar's hospital created space where women could build professional lives in medicine.
She also gave public lectures, worked as a school medical officer, and really believed in women's education. She was ahead of her time in thinking about preventive care, not just treatment.
We should also mention her political side. She supported women's suffrage from the 1870s and was involved in the Women's Trade Union League.
And she wasn't just a political figure, she also continued clinical innovation. In 1906, she published research on postpartum eclampsia, which was a major cause of maternal death. She advocated for more effective treatments long before obstetrics became its own formal specialty.
So whether it was fighting for the vote or for safer childbirth, she was always advocating for women across class lines and across systems.
To really understand her impact, we need to consider the time she lived in. Victoria, how would you describe the broader context she was working in?
Well, she was up against a system that deeply distrusted women's intellectual and professional capabilities. Victorian society defined women's role as domestic, and medicine was one of the most male-dominated professions. Even in the Edwardian period, progress was slow.
And yet she carved out a path, not just for herself but for other women, and she did it by founding things: hospitals, clinics, professional communities.
She died in 1925. Her hospital continued into the 1960s, and today a green plaque in Bristol marks the site of her home. But beyond that, her legacy still doesn't get the attention it deserves.
Dr Eliza Walker Dunbar's life shows us what quiet courage looks like. She didn't just push boundaries, she redefined them.
That's absolutely right. She believed in practical change. She didn't just argue that women belonged in medicine, she created the places and systems where that could happen.